Did you know that many adults over 40 already have some decline in lung strength without noticing it? Most people don't spot changes in breath control, stamina, or how easily they catch their breath until it shows up as tightness, noisy breathing, or struggling on a flight of stairs. The problem is these changes start quietly, long before they become obvious. The good news is you don't need a clinic or fancy gear to check how your lungs are doing. With 4 simple at-home tests you can do in under 10 minutes, you'll get a clear picture of your breathing power. These quick checks reveal if your breathing is slipping, which parts of your breathing need work, and where to begin to improve. What many people do not expect is that a lot of adults over 40 fail at least one of these basic tests the first time they try. That means their lungs or breathing muscles are already weaker than they think, which raises the risk of slower recovery after illness and less stamina during daily life. The earlier you spot these signs, the sooner you can do simple exercises or see a clinician to prevent bigger problems. Before we start, tell us in the comments your age and whether you've tested your breathing at home before. We'd like to hear your results. Also, like this video and subscribe for practical tips on keeping your lungs strong as you age. Now let's dive into the 4 at-home tests to check your lungs and breathing power, starting with the balloon inflation test. Number 1, balloon inflation test. One of the simplest ways to check your lung strength at home is by using a balloon. Almost everyone has blown up a balloon at some point, but few people think about how much effort it actually takes. When you inflate a balloon, your lungs, diaphragm, and chest muscles all work together to push air out of your body with enough force to stretch the balloon's rubber. This is why a balloon inflation test can give you a surprisingly good picture of your breathing power. It is not a medical test in the strict sense, but it can give you useful feedback about how well your lungs are working and how much air you can push out in a single breath. The first thing you need is a regular balloon, nothing fancy. Avoid extra large balloons or balloons with very thick rubber because they can be much harder to inflate and might give you misleading results. A standard party balloon works best. Sit down in a chair or stand up straight to allow your lungs to expand fully. Take a deep breath in through your nose until you feel your lungs are completely filled. Hold it for just a second, then place the balloon between your lips and try to blow as much air as you can into it in one long, steady exhale. The goal is to see how much of the balloon you can inflate in that single breath. If you manage to inflate the balloon significantly with one breath, that usually means your lungs can push out a healthy volume of air. On the other hand, if you struggle to get more than a little puff of air into it, or if you need to pause and take several breaths before the balloon looks even slightly inflated, it could be a sign that your lung capacity or breathing power is weaker than average. The comparison here is not about perfection, but about effort. A strong set of lungs can usually inflate a medium-sized balloon halfway or more in one continuous breath. What makes this test interesting is that it also tells you about the strength of your diaphragm, the main muscle involved in breathing. The diaphragm is a large dome-shaped muscle under your lungs. When it contracts, it pulls down to allow your lungs to expand with air. When it relaxes, it pushes air back out. By inflating a balloon, you are asking this muscle to push hard against the resistance of the balloon's rubber. This effort reflects how well your diaphragm and chest muscles are doing their job. If you find the balloon test extremely difficult, it might mean your diaphragm is not working as efficiently, or your lungs are not able to generate enough pressure. The balloon test can also reveal endurance. Try inflating one balloon fully and then attempt a second one right after. If you get tired quickly, or if you cannot inflate the second balloon nearly as much as the first, it shows your breathing muscles fatigue faster than normal. People with healthy lungs are often surprised by how many balloons they can inflate without feeling exhausted, while those with weaker lungs may feel short of breath after just one. Number 2, candle blow test. The candle blow test is a quick, low-tech way to check how well your lungs and breathing muscles work. It needs only a candle and a lighter or matches. The idea is simple. You take a deep breath, then try to blow out the candle in one steady breath from a set distance. How far you can reliably blow out the flame and how many breaths it takes gives a basic picture of your breath control, lung power, and airway strength. It is not a medical test, but it can be useful to notice changes in breathing or to track progress after breathing exercises. To do the test, set the candle on a stable surface. Sit or stand upright so your lungs can expand fully. Light the candle and let the flame settle. Choose a distance to start, such as 6 inches from the candle tip to your mouth. Inhale slowly through your nose until your lungs feel full. Hold the breath for a second, then place your lips around an imaginary line at that distance and blow in one steady stream. Try to extinguish the flame without puffing or coughing. If you can blow it out in one breath from 6 inches, try again from 12 inches. Keep increasing the distance in small steps. Record the farthest distance where you can still put the flame out in one continuous breath. Write down that number, repeat the test 2 more times, rest a minute between tries and take the average. That average becomes your personal score for the day. What this test measures is a mix of lung force and breath control. A steady, strong exhale comes from the diaphragm, pushing air out, supported by chest and abdominal muscles. If your airways are narrowed or if your lungs are weak, your exhale will be shorter or weaker and you will not be able to blow the candle out from far away. If your breath is quick but not steady, you might puff and the candle will not go out. Being able to blow the flame out from farther away usually means you have good control and reasonable lung power for everyday needs like climbing stairs or talking for longer periods. This test also shows endurance. Try 2 or 3 candle blows in a row with a short rest between. If you can blow the candle out easily once but get much weaker on the second or third try, that shows your breathing muscles fatigue quickly. If you hold your breath for a longer time before blowing, the test will become harder because your lungs and muscles are working against a stronger urge to exhale. Keep the method consistent so you can compare results over time. There are some practical tips that make the results clearer. Do the test in a room with little air movement. Avoid doing it outdoors on a windy day. Do the test at the same time of day and in a similar position, sitting or standing, when you compare results. If you have a cold or are recovering from illness, wait until you feel better because the test will be affected by a blocked nose or sore throat. Use the same kind of candle each time if you want the most consistent reading. A small tea light works well. If you change candle type or room conditions, your score may change without any real change in your lungs. The candle blow test can point to issues that need medical attention. If you notice a steady decline in how far you can blow the candle, or if you suddenly cannot put it out from a distance you used to reach, that may mean your breathing is getting weaker or your airways are more blocked. If you feel chest tightness, wheeze, have severe breathlessness, or cough a lot during or right after the test, stop and contact a healthcare provider. This test is just a screening tool. It does not replace professional evaluation. Number 3, breath hold test. The breath hold test is a simple way to see how long you can comfortably hold your breath. It gives a rough idea of your lung capacity, how well your body handles carbon dioxide buildup, and how strong your breathing control is. This test is easy, requires no equipment, and is useful to track changes in your breathing over time. It can be done sitting down, so it is safe for most people when they follow a few basic rules. To perform the test, sit in a chair with good posture. Take a few normal breaths to relax. Inhale slowly through your nose to fill your lungs, then exhale fully but not forcefully. Take one last deep breath in, as deep as you comfortably can, and then hold your breath. Start a timer the moment you stop breathing in. Hold until you feel a clear urge to breathe or until you feel mild discomfort. Do not push to the point of pain, fainting, or severe dizziness. When you decide to stop, exhale and breathe normally. Record the time in seconds. Rest for at least a minute, then repeat 2 more times and average the results to get a stable number. A longer breath hold time often means your lungs hold more air and your body tolerates carbon dioxide better. However, this test measures more than lung volume. It also shows how your body manages the chemical changes that happen when you stop breathing. Carbon dioxide levels rise while oxygen levels drop. How long you can hold depends on both lung size and how sensitive your brain is to carbon dioxide. Regular breath training can increase your tolerance and lengthen your times. There are several ways to use the test. First, use it as a baseline. Note your average time and check again after several weeks of breathing exercises or physical training. If your time improves, that likely means your breathing capacity or tolerance improved. If it drops, especially alongside new shortness of breath during daily tasks, talk to a doctor. Second, use it as part of breathing practice. Many simple programs teach slow, deep breathing and controlled breath holds to reduce anxiety and improve breath control. For example, after a set of calm breathing exercises, try the breath hold test and you may find the time increases. That is a sign the exercises helped your breathing muscles and your control. Third, watch for red flags. If your breath hold time drops sharply over days or weeks, or if you cannot hold for even a short period compared to earlier results, this may indicate a change in lung function or heart function. Also, if you feel lightheaded, faint, or get severe chest pain during the test, stop and seek medical help. People with heart disease, recent heart attack, uncontrolled high blood pressure, or certain lung diseases should not do this test without medical advice because it can raise blood pressure and heart rate during the hold. Number 4, peak flow meter, if available. A peak flow meter is a small handheld device used to measure how fast you can blow air out of your lungs. It gives a number called peak expiratory flow, PEF. This reading helps you track airway narrowing and can be especially useful for people with asthma or other obstructive lung conditions. A peak flow meter is more precise than the balloon or candle tests. It is often recommended by doctors to monitor breathing over time and to spot early signs of flare-ups. To use a peak flow meter, stand up if you can. Make sure the marker on the device is set at the bottom. Take a full deep breath in, place the mouthpiece in your mouth with a tight seal, and blow out as hard and fast as you can in a single blow. Record the number shown on the scale. Rest for a minute, then repeat 2 more times. Use the highest of the 3 numbers as your daily reading. Write it down in a diary or app. Do the test at the same time each day for consistent comparison. Many people do it in the morning and again in the evening. Peak flow numbers vary by age, sex, and height. Your healthcare provider can help you find your expected normal range. Over time, you build a personal best number, which is the highest reading you achieve when you are well. Your provider may ask you to track readings and use a zone plan. A common approach divides values into green, good, yellow, use caution, and red, seek medical help. For example, green might be 80% to 100% of your personal best, yellow 50% to 80%, and red below 50%. If your number drops into the yellow zone, you may need to increase medication or change activity. If it drops into the red zone, follow medical instructions immediately or seek urgent care. A peak flow meter is useful because it detects airway narrowing before you may feel severe symptoms. You might notice shortness of breath or wheeze only after significant change, but the peak flow can fall earlier. That makes it a valuable tool for early action to prevent worsening. It also helps you measure the effect of medication. If a bronchodilator raises your peak flow significantly, that confirms part of the airway problem responds to the medicine. Now let's discuss natural ways to improve lung and breathing power. Breathing better starts with a few general ideas. Keep airways clear, move your body in ways that raise your breathing demand safely, build the muscles you use for breathing, eat to lower inflammation and support oxygen delivery, and protect your lungs from bad air and infections. Doing these things together will give you steady gains. Below, I list 5 specific methods you can use with clear steps and examples you can try at home. If you have a diagnosed lung or heart condition, Check with your doctor before starting any new exercise or major diet change. Number 1, diaphragmatic belly breathing with progressions. Start by learning to use the diaphragm well. Lie on your back with knees bent or sit tall in a chair. Place one hand on your chest and one on your belly. Breathe in through your nose so the hand on your belly rises more than the hand on your chest. Breathe out slowly through pursed lips. Do this 2 to 3 times a day for 5 to 10 minutes to build awareness. Once you are comfortable, add progressions. Practice a timed inhale-exhale pattern. For example, inhale for 4 seconds, exhale for 6 to 8 seconds. Next, add light resistance. Place a firm straw in your mouth and exhale through it slowly, or blow through a small diameter mouthpiece used for breathing training. After a few weeks, increase the resistance or lengthen the exhale time. This trains the diaphragm and the muscles that control forced exhalation, which helps when you need to cough, speak, or exercise. Keep sessions steady and stop if you feel dizzy or very short of breath. Number 2, inspiratory muscle training, IMT, with a device or straw method. A targeted way to strengthen the muscles used to inhale is to use an inspiratory muscle trainer. These are small handheld devices that create resistance when you breathe in. If you do not have a device, you can use a wide straw and gradually switch to a narrower one as you get stronger. Aim for 2 short sessions a day of 15 minutes total work. A simple plan is 30 breaths per session against resistance, 3 sets with brief rests. Track the resistance setting and the number of breaths so you can progress every week. Stronger inspiratory muscles let you take fuller, easier breaths during activity and reduce the feeling of breathlessness. Again, if you have heart disease or uncontrolled high blood pressure, talk to a clinician before heavy IMT because it can mildly raise blood pressure during use. Number 3, interval walking or stair repeats to raise fitness safely. Cardio fitness directly affects how well your lungs meet oxygen demands. Do interval-style walking rather than long, slow walking for better gains in less time. For example, after a 5-minute warm-up walk, walk briskly enough to raise your breathing for 1 minute, then slow for 2 minutes. Repeat that 6-10 times. If stairs are available and safe, do stair repeats. Walk up a short flight at a moderate pace. Walk down slowly for recovery. Repeat 6 to 8 times. Keep intensity at a level where you can talk in short phrases but not sing. Do these sessions 3 times per week. And on other days, do gentle movements so your body adapts without overtraining. Over weeks, you will notice less breathlessness for the same effort and better tolerance for daily tasks. Number 4, diet choices that support oxygen delivery and reduce airway irritation. Certain foods can help support breathing when used as part of a balanced diet. Beetroot juice or cooked beets are high in dietary nitrates. Several studies show dietary nitrate can improve exercise tolerance in some people by improving blood flow and oxygen delivery. Aim for a small glass, about 100 to 200 ml of beetroot juice a few hours before exercise if you tolerate it. Include fatty fish like salmon or sardines 2 to 3 times a week for omega-3 fats that help lower inflammation. Make berries, citrus and leafy greens regular parts of your meals for vitamin C and antioxidants that support lung tissue and immune defense. Magnesium-rich foods like nuts, seeds and whole grains can help relax airway muscles in some people. Stay well hydrated. Thin mucus clears easier when you drink enough water. Avoid large amounts of dairy only if you notice it thickens your mucus. Most people do not need to cut it out completely. These dietary steps are supportive. They do not replace medical treatments if you have lung disease. Number 5, voice and airflow training, humming, singing, and bubble blowing. Exercises that control airflow and keep airways moving can strengthen breathing without heavy impact. Humming or gentle singing increases nasal nitric oxide, which helps open airways and can ease breathing comfort for minutes after practice. Try a short daily routine, hum for 1 to 2 minutes, then sing a simple scale for 2 to 3 minutes, focusing on steady breath and an even tone. Bubble blowing is another practical drill. Blow through a straw into a cup of water and make steady bubbles for 30 to 60 seconds, rest, and repeat 3 times. This creates gentle back pressure that helps keep small airways open and trains controlled exhalation. Speech therapists and respiratory therapists often use these techniques to help people learn to manage breath during talking or exertion. Practicing short sessions daily builds control and reduces panic during breathless episodes. If this helped, like and subscribe for more simple, practical health tips. Tell me in the comments which technique you'll try first. I read and reply to messages.